Good morning. I am Dr. Sridhar Kalyanasundaram, consultant neonatologist. Welcome to my channel. Thank you for subscribing and turning your notifications on, and thank you for sharing with your friends as well. I would request you to spread the word more so it may benefit more users. So, as I have discussed earlier, the idea of this channel is to disseminate information to parents as well as to medical colleagues as best as we can. And for parents who are watching this video, I would request you to go through the playlists, because there are more videos now. We have exceeded 100 videos on the channel now, and it may be challenging to find the videos which are more suitable for you. I have organized it in terms of playlists, and you can look at the playlist for under 1 year of age. You can look at the playlist for infant nutrition. You can look at the playlist for acute problems, which include fever and infections and so on. And for the medics as well, it has been organized into playlists like Basics of Neonatology, the NRP series, the Oxygen series. So I would encourage you to look through these playlists and select the videos that are of interest to you, and please share it with other friends and relatives who might benefit from that as well. So in this video, we'd be looking at what to do if the baby is choking during the breastfeed. This is quite a common concern that the parents have, and it's very worrying because choking is a serious problem. So the manifestations of choking may be in the form of baby struggling to feed. They may not complete the feed. There may be coughing and spluttering during the feed, and the baby may look away from the breast. The baby may push the breast with the hands. If it persists, they may start refusing feeds because the baby also gets scared and the mother is anxious, the mother gets scared as well. So the lactation establishment doesn't go as well as you would want it to be. Rarely, if the choking is significant, there may be a color change, and most of the time, because the mother is awake while feeding, they're able to realize it and take the baby off the breast before anything serious happens. However, some babies may get a little bit of milk into the lungs despite their coughing and trying to clear the airway, and this may result in a fast breathing episode soon after this, which may indicate a mild aspiration, which means a little bit of milk has gone into the lungs. Most of the time in a well baby, they can clear it on their own. So if the baby improves over the next hour or so, the breathing is not too labored and the baby's color looks well, the baby responds well, you don't need to panic. However, if you're worried, please take to your pediatrician so the oxygen levels can be checked and confirm that the baby does not need any intervention. So what are the possible causes for this to happen? I mean, prematurity is one of the important factors, and if the baby is more premature, obviously they are going to be admitted in the NICU already, and we have a plan to progress with the suck feeding in a gradual way as per the baby's tolerance. If the baby is borderline premature, this becomes more challenging because these babies are usually a good size. They are not kept in the hospital more than the normal stay of 2 days or so, and during this maturation phase, the baby is progressively maturing, so it's not an abrupt maturation, and the coordination of the suck and swallow, which is very important for appropriate swallowing, is still developing in these babies. And some babies behave a little immature compared to their own maturity. This can happen in a term baby as well, and so it may take a few more days for them to mature, and during this phase they may need closer support. When we say coordination of suck and swallowing, it means that when the sucking is happening, the baby is able to breathe, but they have to pause the breathing to swallow. And during this phase, there is a protective reflex which closes the airway, because the airway and the foot pipe are adjacent to each other. The airway comes in the front, the foot pipe comes in the back. There is a leaf-like structure that covers the airway during the swallowing phase called the epiglottis, and this coordination of the closing of the epiglottis with the swallowing has to happen appropriately to avoid the choking episodes. Where the oral intake happens abruptly, the baby may be surprised, and this may lead to problems. So like if you're giving oral drops to the baby, we always encourage you to put on the side of the cheeks so the baby realizes there is something coming, they're not surprised and they don't choke. Sometimes it's a fast let down reflex. So the let down reflex is where the maternal hormone called oxytocin is released in our brain. The very thought of breastfeeding, the very thought of the infant may sometimes cause milk to eject from the breast, and that is because of this reflex being active. A fast letdown reflex means the milk spurts sometimes from the breast, and as I said earlier, if the baby is not ready to get the milk, not ready to swallow, they may be surprised and may choke. So this is one reason. And oversupply of milk as well may lead to milk spurting or the flow being too fast for the baby. Discrepancy in the nipple size and the breast size compared to the baby's mouth may contribute as well. So what are the possible measures we can do to handle this? Obviously, if it's a premature baby, a gradual practice will help, and obviously you may have to liaise with the lactation consultant in your NICU to help you with that system, how to improvise for that baby. It doesn't mean you need to bottle feed the baby. You may do partly with the cup or syringe feeding along with the breastfeeding. And recognize and correct the problems with latching, because this is an important problem where the nipple is taken into the mouth without much of the breast tissue. The baby is not able to regulate the flow because the ducts which store the milk are around the areola, and the baby actually can clamp on it to adjust the pace of milk release. So if this doesn't happen, the milk flow may be faster. Avoid overfeeding in terms of both the duration and frequency. At the same time, try to feed the baby before the baby is too hungry. So look at the hunger cues. I always tell parents not to confuse early signs to hunger cues to avoid overfeeding, which is not good as well. But at the same time, have a definite pattern developing. The signaling between the mother and the baby has to be established well, so that the mother knows when the baby is hungry before the baby is agitated because of the hunger. When they get agitated, they get frantic and they may start sucking without coordination. They get impatient, and if the flow is not good also, they get restless. If the flow is too fast, they may choke. So anticipating and feeding appropriately is important. This is a challenge. It may take a few days for the inexperienced mother to get used to it. So look at the cues, try to understand what your baby is trying to say, and then the signaling will work well. If both are anxious, it may not work well, so you may need support. The fast letdown does not always mean oversupply. This may be related to the hormonal status of the mother. Try to be relaxed as best as possible and try to feed the baby at relatively shorter intervals before the breast is too full, if the fast letdown is a problem. Because if the breast is too full, the engorgement contributes to the fast letdown reflex. Some mothers may benefit from expressing a small volume before taking the baby to the breast. So this kind of releases the milk which is ready to come out and also slows down the letdown reflex a bit. If the baby is agitated, you can actually feed this to start with a cup or syringe to calm down the baby, and then start the breastfeed. So it helps both factors, the mother's factor in terms of the milk being excessive or flowing fast, and the baby's factor in calming down the baby. So this is a useful tip that parents may use, but don't overdo the expressing, as we will discuss next. Try reclining more so the baby is above the breast. So remember that gravity pulls you downwards. So if the mother is in this posture, the baby is up, the milk flow due to gravity may be drawn backwards, so the effect on the baby's choking is less. What to do if there is oversupply? So there is always a imbalance between supply and demand in the beginning, because the first 2-3 days the mother doesn't produce much milk, the baby is demanding more, and then the mother's supply starts, the lactogenesis 2 starts, and the milk starts coming well. And in this case, the baby hasn't learned to feed very well, so the oversupply may briefly be there. The mother may feel engorged. This is partly because she is not used to the engorged sensation in the primigravida mothers, but also because the milk is increasing. So this is one time where if the baby is not able to transfer the milk appropriately, she may be producing milk, but the baby may still be unsatisfied. So during this phase, you may need to express to both soften the breast, baby can get a better grip, and also empty the breast so the milk supply increases continuously, and the baby is fed so they're not that agitated and they can suck peacefully on the breast. So you may need support during this phase if it happens. If it is a definite oversupply, as it can happen in some mothers, try short feeds on both breasts. This will avoid engorgement and also avoids emptying too much, which may inhibit the milk supply. So if the milk is retained in the breast, the production is reduced a little bit. That's why expressing in addition to the baby's feeding to empty the breast increases the supply. You can handle it the same way, that if you don't empty the breast, the supply reduces a bit. So you may use this to the advantage if there is an oversupply issue. But plan it accordingly. It may work for some mothers, it may not work for the others. Where there is an issue of oversupply, you avoid excessive pumping. You have to slow down on the pumping for a few days till the supply is more balanced, and empty only if needed in these cases. So keep a little bit of milk in the breast, which will inhibit the oversupply. So this is not a common problem. More often we have a problem with undersupply rather than oversupply. So the mothers who need to stimulate the breast by emptying, don't be confused by this aspect. So be aware of the signs of choking, because it's a potentially life-threatening event. I would recommend you to watch the video on infant CPR and choking. I will put the link in the description, and how to manage choking in infants. It's a very important information. Do share that with your friends as well. I hope it's useful. I would recommend you to subscribe if not already done. Turn your notifications on, and please do share. Thank you.